Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and do some range of motion for your shoulder, okay? We don't need any equipment for this. I'm going to provide us some privacy and we'll get started, okay? At this time, you want to make sure that you provide complete privacy for your patient. All right, I'm going to take your arm out right here. I'm going to keep you covered up. All right. Now, at any time, if you feel any discomfort or any pain, please let me know and we'll stop the exercise, okay? In reality, you will actually have the bed at waist level when you're doing any kind of care at the bedside, but for testing purposes, you don't have to raise this bed up for that. So we're going to just leave it as it is. But please remember, all healthcare workers should always make sure that that bed is at waist level anytime you're doing care at this bedside for your safety as well as your patient. Now, you want to make sure when you're doing range of motion exercises that you're supporting the person's wrists as well as their elbow. That's very important. You also notice in the steps as it's going up on the screen, it tells you we're going to be doing flexion and extension. When we do flexion, we're going to raise the arm up to the ear level and then back down, extension. We're going to do that a total of 3 times, slowly and watching the patient at all times. You ready, Ms. Smith? All right, we're going to go up to your ear level. Good. I'm going to bring it back down. How does that feel, okay? We're going to do that again. And we're going to do it one more time. Good. Is that okay? Now it's also requiring that you do what we call abduction and adduction. When you're doing that, that's just you taking the arm out away from the body and then bringing it back. Again, you want to do it a total of 3 times. When we do exercises, repetition of 3s is very important because that makes sure that the range of motion exercises are being done correctly and appropriately in regards to making sure those joints are moving. Again, you're going to support the wrist and the elbow. We're going to take it out. 1. You okay? And take it out again. Again, you just let me know if you're having any discomfort, okay? I'm going to do it one more time. Very good. That's good. One of the things you want to remember with range of motion exercises, they're very important for us to do for our patients because they prevent the possibility of contractures. Now, we're going to make sure that Ms. Smith has her call bell before we leave her. So, Ms. Smith, thank you again. Here's your call signal. Let me know if I can do anything else for you, okay? You want to make sure that that bed is in its lowest position. And again, you will make sure you wash your hands at the end.